You've probably already seen the headline, Hantavirus cruise ship outbreak, and the moment you saw it, your brain likely went in one of two directions, either immediate panic or immediate dismissal. Here we go again. Another virus scare, another media overreaction. But here's the uncomfortable truth most people don't realize. Both reactions can leave you dangerously unprepared. Because when people panic, they stop thinking clearly. And when people dismiss something too quickly, they stop paying attention entirely. What I'm about to explain to you today is not fear-based. It's not sensational. And it's definitely not another attempt to keep you glued to a screen through anxiety. This is about understanding risk correctly. Because once you understand how hantavirus actually works inside the human body, once you understand how exposure truly happens, and once you understand why infectious disease specialists treat this virus very differently from airborne pandemic pathogens, everything about this story changes, especially for men over 45. And there is one concept I need you to remember throughout this entire discussion, something I call the invisible exposure problem. That single concept explains why hantavirus feels so frightening when it appears in headlines, even though the average person still misunderstands almost everything about it. And once you understand that invisible exposure problem, you'll never look at enclosed spaces the same way again. Now, before we get into cruise ships, outbreak investigations, or fatality statistics, we need to establish something critical first. Hantavirus is not a new virus. That matters enormously. This is not another unknown pathogen suddenly appearing from nowhere. Hantavirus is actually a family of viruses. Scientists have identified roughly 20 related strains over decades of study. The name itself comes from the Hantan River in South Korea, where one of the earliest strains was first documented in the 1970s. So right away, I need you to separate this mentally from what happened in early 2020. COVID was dangerous, partly because humanity was dealing with a completely novel pathogen. Nobody initially understood how efficiently it spread. Nobody knew the transmission patterns. Nobody understood the long-term complications. Unknowns create chaos. Hantavirus is different. Scientists understand the transmission routes. They understand the environmental conditions required for exposure. And they understand which situations elevate risk and which do not. That distinction alone should immediately calm some people down, but it should also make others pay closer attention. Because known pathogens still become deadly when people misunderstand how they operate. Most people first heard the word hantavirus during the outbreak in the American Southwest back in 1993. The Four Corners region, where Colorado, Utah, Arizona, and New Mexico meet, experienced a cluster of severe respiratory illnesses with alarmingly high mortality rates. Healthy young adults were suddenly developing catastrophic lung failure, and physicians at the time were deeply alarmed because the disease progression moved frighteningly fast. That outbreak forced the medical community to study hantavirus far more aggressively, and what researchers discovered was something both reassuring and deeply unsettling at the same time. Reassuring because hantavirus does not spread efficiently between humans like influenza or COVID, but unsettling because the exposure mechanism is something most people would never recognize in the moment. And this is where we arrive at the invisible exposure problem. Most people assume viruses spread through obvious contact. Someone coughs near you. Someone sneezes. Someone looks visibly sick. Your brain recognizes danger. But hantavirus often works differently. The virus is carried primarily by rodents, not pets, not random strangers in grocery stores. Specific rodent species. In North America, the deer mouse is one of the primary carriers. The virus exists inside rodent urine, rodent droppings, and rodent saliva. Now listen carefully to this next part, because this is the piece almost nobody explains correctly. Note 10. When those excretions dry out over time inside enclosed spaces, they can break down into microscopic particles. Invisible particles. Particles too small to see, too small to smell, too small to notice. And once disturbed, those particles can become airborne. That's the moment exposure happens. Not from another person, not from casual conversation, not from standing beside someone, from breathing contaminated particles inside enclosed environments. Think about the kind of places where that becomes possible. A garage closed all winter. An old storage shed. A cabin nobody has entered for months. An attic. A basement. A barn. You walk inside. You start sweeping dust, moving boxes, opening containers. And without realizing it, you may be pushing contaminated particles directly into the air you're breathing. No warning, no immediate symptoms, no signal from your body telling you danger is present. You simply inhale and walk away feeling perfectly normal. That is what makes hantavirus psychologically disturbing. The exposure itself feels completely invisible. Here's what makes hantavirus so dangerous. Not just the mortality rate, not just the rarity, not even the exposure mechanism. It's the delay, the silence between exposure and collapse. Because after someone inhales contaminated particles, absolutely nothing happens at first. No coughing, no burning sensation, no immediate illness. The person feels completely normal. They go to work, they exercise, they spend time with family, they sleep normally. And during that entire period, the virus may already be replicating inside the body without a single warning sign. That delay is what catches people off guard. And by the time symptoms begin, many patients assume they simply caught a routine viral illness. This is where understanding the progression becomes critical. The form of hantavirus found primarily in North and South America is called Hantavirus pulmonary syndrome, or HPS. And in its earliest phase, it looks deceptively ordinary. Fever, muscle aches, fatigue, headache, sometimes chills, sometimes nausea. The kind of symptoms millions of people ignore every year. And that's exactly why this virus becomes so dangerous, because the patient often waits. They assume it's influenza, a seasonal virus, exhaustion, a passing infection. So they rest at home, drink fluids, and expect improvement. But somewhere between 3 and 5 days after symptoms begin, the illness can suddenly change direction. And when it changes fast. The virus triggers a severe inflammatory response inside the lungs. Tiny blood vessels begin leaking fluid into lung tissue. The lungs slowly start filling with fluid from the inside, not because the person is drowning externally, but because the body itself is losing control of fluid regulation inside the respiratory system. This is the stage physicians fear most, because once pulmonary involvement accelerates, oxygen levels can collapse with terrifying speed. The patient suddenly notices breathing feels different, heavier, shorter, more difficult. Walking across a room feels exhausting. Chest tightness develops. Air hunger begins. And in severe cases, a patient can deteriorate critically within hours, not days, hours. This is why early recognition matters so much. Not panic. Recognition. There's a difference. Because if supportive treatment begins early enough, oxygen support, fluid management, intensive respiratory care, and when necessary, mechanical ventilation, survival odds improve significantly. But delayed intervention can become catastrophic. And this is where those fatality numbers people keep posting online require proper context. The mortality rate for hantavirus pulmonary syndrome is approximately 38%. That number sounds horrifying, and medically speaking, it is serious. Roughly 1 out of every 3 diagnosed patients does not survive. But statistics without context create fear instead of understanding. So let's add context. Case fatality rate and population risk are not the same thing. This distinction matters enormously. A disease can carry a very high fatality rate while still posing extremely low overall risk to the average person if exposure itself remains rare. And with hantavirus, exposure scenarios are genuinely limited. This virus does not spread efficiently through casual human interaction. You do not walk past someone in a supermarket and catch hantavirus. You do not typically contract it through shared indoor air the way respiratory pandemic viruses spread. You generally need a very specific environmental exposure. Rodent contamination. Enclosed spaces. Disturbed particles. That's a narrow pathway compared to airborne viral transmission. And this is why global health authorities continue to classify overall population risk as low. Now, does low population risk mean ignore it completely? Absolutely not, because your personal risk depends entirely on your personal environment. A man living in a high-rise city apartment with no rodent exposure history has a vastly different risk profile than someone working daily in barns, agricultural structures, construction sites, wildlife management, forestry, or old storage environments. This is where people make a dangerous mistake. They hear low risk and mentally translate it into irrelevant. But medicine doesn't work that way. Risk is contextual, individual, situational, and the people who misunderstand that concept are often the ones who become vulnerable without realizing it. Now, there's another important detail most news reports barely mention. There are actually two major disease patterns caused by hantavirus. The pulmonary form affects the lungs, but another form seen more commonly in Europe and Asia attacks the kidneys instead. This condition is called hemorrhagic fever with renal syndrome, and its progression can be equally devastating. Instead of primarily damaging lung tissue, the virus targets the kidneys and blood vessels. Patients may develop severe internal bleeding, dangerous inflammation, and acute kidney failure. Some require emergency dialysis just to survive, and depending on the strain involved, mortality rates can climb even higher than pulmonary syndrome, up to 50% in severe cases. Again, not to frighten you, but to ground this discussion in reality instead of emotional extremes, because fear without facts creates paralysis, and dismissal without facts creates negligence. What you need is neither. You need clarity. Now, let's return to the cruise ship outbreak specifically, because this is where people are becoming confused. Many individuals immediately assumed a cruise ship outbreak means airborne human-to-human transmission. That assumption is understandable after the collective trauma of recent years. But current evidence suggests something very different. Authorities investigating the outbreak are focusing heavily on environmental exposure and rodent control protocols aboard the vessel. That matters, because if the transmission pathway remains rodent-based rather than efficiently human-based, then this situation belongs in an entirely different category from pandemic respiratory spread. And there is only one known hantavirus strain that has shown limited human-to-human transmission in documented cases, the Andes virus in South America. Even then, transmission remained limited, not remotely comparable to viruses like COVID or influenza. Every other major hantavirus strain still requires that environmental rodent exposure route. That single fact changes the entire risk landscape. But there's another piece most men over 45 are not thinking about, and it may be the most personally relevant part of this entire conversation. Because once exposure happens, your body's ability to respond effectively depends heavily on something most people ignore until it's too late: baseline immune competence. And the truth is, after age 45, your immune system no longer performs the way it did at 25. There's something most men do not want to hear. Your immune system ages faster than you think. Not dramatically overnight, not in some obvious Hollywood-style collapse, but gradually, quietly, year after year. And by the time most men reach their late 40s or early 50s, the body's response to serious infections is no longer operating at peak efficiency. That matters more than almost anyone realizes. Because when physicians assess risk from infectious diseases, we do not only look at the pathogen itself, we look at the terrain the pathogen is entering. And the terrain is your body, your inflammation levels, your sleep quality, your metabolic health, your organ function, your immune resilience. This is why two people exposed to the same infectious threat can experience entirely different outcomes. One recovers quickly, the other deteriorates rapidly. And in men over 45, there are several hidden physiological changes that directly influence how effectively the immune system responds under pressure. The first is chronic inflammation. Visceral fat, the fat carried around the abdomen, is not passive storage tissue. It is biologically active. It constantly releases inflammatory chemicals into the bloodstream. Low-grade inflammation becomes the body's baseline state, and when a serious infection arrives, the immune system must now fight from a physiologically disadvantaged position. This is one reason abdominal obesity correlates so strongly with worse outcomes across multiple infectious illnesses. Not because of appearance, not aesthetics, function. Then, there's sleep. I cannot overstate this enough. Men treat sleep deprivation as if it's a personality trait, as if functioning on 5 hours somehow signals discipline or toughness. Medically, it signals impaired immune surveillance. During deep sleep, the body regulates immune signaling molecules, repairs tissue, and coordinates defense responses. Consistent sleep restriction measurably weakens infection response. And unfortunately, many men over 45 are operating chronically sleep-deprived without even recognizing it anymore. They normalize exhaustion, normalize brain fog, normalize low energy, normalize poor recovery, until the body faces something serious. And suddenly, those deficits matter. Vitamin D deficiency is another enormous issue, especially after 50. Low vitamin D levels are extremely common in older adults, particularly those spending most of their time indoors. And vitamin D is not simply about bones. It directly affects immune modulation. Your body uses it during pathogen response. If you have not had your vitamin D levels checked recently, ask your physician for a 2,5-hydroxy vitamin D test. Not because vitamin D is some magical cure-all circulating on the internet. It isn't. But because deficiency weakens the body's ability to respond efficiently when infections occur. And this becomes even more important if you already have chronic medical conditions. Kidney disease, hypertension, diabetes, cardiovascular disease, respiratory conditions. Anything that reduces baseline organ reserve changes how your body tolerates serious illness. This is why individualized risk matters more than generalized headlines. And this is the exact mistake many people continue making. They want one universal answer. Should I worry or not? Medicine almost never works that way. The correct answer depends on exposure, context, and biological resilience. Now let's talk honestly about psychology for a moment, because public reactions to health headlines tend to split into two unhealthy extremes: panic or disengagement. And ironically, the second group often becomes more vulnerable. The panic people are hyper-alert. They're paying attention, reading information, asking questions, taking precautions. But the dismissive group hears low overall risk and completely disconnects mentally. That's dangerous, because individual exposure risk is not evenly distributed across society. If you work in agriculture, forestry, pest control, construction, environmental cleanup, wildlife management, or maintenance of older buildings, your exposure profile is different. If you live in rural environments with rodent activity near your home, your risk profile changes. If you own a cabin, a shed, a storage unit, a basement, or an old garage that has sat closed for months, this discussion applies directly to your life. And here's the uncomfortable truth. Many exposures happen during completely ordinary moments. Spring cleaning, opening a vacation property, cleaning an attic, moving old furniture, sweeping dust in enclosed areas. That's why situational awareness matters so much more than generalized fear. And this brings us back to the invisible exposure problem. The danger is silent. You do not smell it. You do not feel it. There's no immediate warning. The person exposed often walks away, believing nothing happened. And then comes the incubation period. This is the second layer of invisibility people fail to understand. Symptoms do not usually appear immediately after exposure. In fact, hantavirus incubation can range from 1 week to as long as 8 weeks. Think about what that means psychologically. A person cleans a contaminated shed in early May, feels completely normal afterward, lives life normally for weeks, then sometime later develops fever, fatigue, body aches, and breathing symptoms. Most people would never connect those symptoms to something they did 6 weeks earlier. That's why awareness changes outcomes. Not panic. Awareness. Knowing your exposure history, recognizing the symptom pattern, and understanding when immediate medical evaluation becomes necessary. Because once pulmonary symptoms begin progressing, time matters. And one detail can dramatically change the speed of diagnosis inside an emergency room. Telling the physician about possible rodent exposure. That single sentence immediately changes the clinical thought process. It shifts physicians toward considering hantavirus earlier instead of assuming ordinary viral illness. An earlier recognition can save lives. Now, there's another critical mistake people make after hearing all this information. They begin focusing only on the virus itself. But experienced physicians think differently. We focus on systems, environment, preparedness, risk reduction, because the smartest strategy is not obsessing over pathogens. It's reducing unnecessary exposure opportunities before they happen. Most people think danger comes from the rodents themselves. It usually doesn't. The greatest risk often comes from what people do after the rodents are gone. And this is where perfectly intelligent individuals accidentally create the exact exposure event they were trying to avoid. Picture this for a moment. You open an old storage shed that's been closed for months, maybe years. The smell hits you immediately. Dust in the air, old cardboard boxes stacked in corners, signs of droppings near the walls, nesting material behind containers. And your instinct, almost everyone's instinct, is to clean quickly. Grab a broom, sweep it out, vacuum the floor. blow the dust away. But medically speaking, that response can be the most dangerous moment in the entire scenario. Because the moment dry contaminated material gets disturbed aggressively, microscopic particles become airborne. And once those particles are suspended in enclosed air, inhalation becomes possible. That's why professionals never approach rodent-contaminated environments casually. There's a protocol, a sequence, and the order matters. The first step is ventilation. Always, before touching anything, open every accessible window and door. Create airflow, then leave the area. Wait at least 30 minutes before beginning cleanup. That delay allows airborne particles already present to disperse instead of concentrating around your breathing zone. Most people skip this step entirely. Huge mistake. Second step, respiratory protection. Not a cloth mask. Not pulling your shirt over your nose. An N95 rated mask minimum. Why? Because you are dealing with particles too small to see. The absence of visible dust does not mean the air is safe. That's another psychological trap humans fall into. We trust our senses too much. But hantavirus exposure often bypasses sensory warning systems completely. Third step, never dry sweep. Never. This is where many exposures likely occur. Dry sweeping launches particles into the air. The same applies to standard vacuum cleaners without HEPA filtration. You are aerosolizing contamination. Instead, surfaces should first be sprayed thoroughly with disinfectant. The traditional recommendation is a bleach solution, roughly 1 part household bleach to 10 parts water. Wet the surfaces completely. Droppings, floors, shelves, any potentially contaminated area. The moisture prevents particles from becoming airborne during cleanup. Then wipe carefully, slowly, controlled movement. Not aggressive cleaning. This sounds simple, because it is simple. But simplicity only works when people actually follow the protocol. And most people don't think about these precautions until after exposure may already have happened. That's why awareness beforehand matters so much. Now here's something important many viewers need to hear. The existence of these precautions does not mean every rodent exposure automatically leads to infection. It doesn't. In fact, most people exposed to rodent environments never develop hantavirus. Again, population-level risk remains low, but low risk does not mean zero risk. And the problem with low-frequency, high-severity events is that humans tend to ignore them until they become personal. That's human nature. We psychologically prioritize immediate visible threats over invisible statistical ones, which is exactly why public health messaging around hantavirus often gets distorted. One side creates panic. The other creates complacency. And both miss the middle ground, where rational behavior actually lives. Now let's talk about something else the headlines barely explain. Why outbreaks associated with enclosed environments draw such serious attention from investigators. Whether it's a cruise ship, an old building, a rural cabin, or a maintenance facility, investigators immediately begin examining environmental conditions, ventilation systems, rodent control failures, food storage procedures, waste management. Because with hantavirus, environment is everything. The virus itself depends heavily on ecological conditions to reach humans. That's very different from highly contagious respiratory viruses capable of sustained person-to-person spread. And this distinction matters psychologically, because many people are still mentally trapped in pandemic thinking. They hear the word outbreak and automatically imagine uncontrolled airborne spread between people. But hantavirus does not generally behave that way, which is precisely why targeted prevention works so effectively. Now there is one more layer to this discussion that I think deserves honesty. Fear itself changes decision-making. And after years of nonstop health headlines, many people have developed deeply unhealthy relationships with medical information. Some consume fear constantly. Others shut down completely and refuse to engage with any health information at all. Both extremes become dangerous over time. The goal is not to live afraid. The goal is to become difficult to surprise. That's what informed health awareness actually means. You understand the risk. You understand the exposure pathway. You understand the warning signs. And then you live rationally, not obsessively, not carelessly. Rationally. And this becomes especially important for men over 45, because many men in this age group delay medical attention far too long once symptoms begin. They minimize, push through, assume things will improve tomorrow. That mentality becomes dangerous with illnesses capable of rapid respiratory decline. Remember what we discussed earlier? Because by the time symptoms appear, the original exposure event may feel disconnected from the illness entirely. And that's exactly why early awareness matters more than late panic. Not because awareness eliminates all risk, but because it changes behavior before exposure happens, and it changes response speed once symptoms begin. But there's still one final misunderstanding I need to address, because a large number of people watching this are still quietly asking themselves the same question. If the fatality rates are so high, why don't we hear about hantavirus constantly? And the answer reveals something extremely important about how infectious diseases are actually evaluated in the real world.